Welcome to Fair Value Clear Waters, Hospice Physician Compensation Compliance. I'm Jake, and joining me today is Rachel, an expert in healthcare regulatory matters. Rachel, it's wonderful to have you here.
Thank you, Jake. I'm really looking forward to this conversation. It's such a vital area for hospice providers to understand.
Absolutely. Today, we're really going to dive into the complexities of anti-kickback laws, fair market value, and the various employment structures that impact hospice compensation. It's a landscape fraught with potential pitfalls, isn't it?
It certainly is. Navigating these regulations requires a deep understanding, not just of the legal framework, but also how to synthesize compliance with the core mission of patient care. It's a delicate balance that demands constant vigilance.
That constant vigilance you mentioned, Rachel, really brings us to the heart of the matter, the anti-kickback statute. For our listeners, could you elaborate on why this particular statute is such a critical concern for hospice physicians and organizations?
Absolutely, Jake. The Anti-Kickback Statute, or AKS, is designed to prevent any form of remuneration that could induce or reward referrals for services payable by federal healthcare programs. For hospice physicians, this means they must be incredibly careful to avoid any appearance that their compensation is tied to referring patients to the hospice.
So it's not just about outright kickbacks, but even the appearance of an inducement. That sounds like a very fine line to walk. What are some of the primary ways hospices try to protect themselves from potential AKS violations?
One of the most significant protections comes from what are known as safe harbors under the AKS. Specifically, the employment safe harbor is crucial. If a physician is a bona fide employee of the hospice, their compensation is generally protected, provided it meets certain criteria.
That distinction between an employed physician and, say, an independent contractor must be incredibly important then. How does that working relationship structure impact AKS compliance?
It's absolutely critical. For independent contractors, the relationship is scrutinized much more closely. Their compensation must be set at fair market value for the services they actually provide, and it cannot vary based on the volume or value of referrals. This is where things can get very complex.
And that brings us to fair market value, or FMV. How do hospices typically determine what constitutes a fair market value payment rate for their physicians, especially when trying to avoid any perception of a kickback?
This is where third-party services become invaluable. Hospices often engage independent valuation firms to determine FMV payment rates. These firms use robust data, considering factors like geographic location, the physician's medical specialty, and the specific duties performed to establish a defensible compensation rate.
So it's not just an internal decision, but an objective, documented process. What happens if a hospice needs to pay a physician outside of those recommended rates?
Even then, they must have strong legal documentation to justify any deviation. The key is to prove unequivocally that the hospice physician is being paid solely for the legitimate work they perform and not for any referrals they might generate. Transparency and meticulous record-keeping are paramount.
It sounds like the legal documentation isn't just a formality, but a fundamental shield against potential scrutiny. It's about demonstrating intent and adherence to the spirit of the law.
Precisely. It's about building a robust compliance program that can withstand an audit. Every payment, every contract needs to clearly demonstrate that it's for legitimate services at a fair rate, completely divorced from any referral volume.
Rachel, this has been an incredibly thorough and, frankly, vital discussion. We started by acknowledging the complexities and the need for constant vigilance, and I think we've really illuminated how the anti-kickback statute, fair market value, and those crucial employment structures all intertwine.
Absolutely, Jake. The takeaway, I hope, is that while it's a challenging landscape, a proactive approach with robust documentation and a clear understanding of these regulations isn't just a legal necessity, but it's fundamental to upholding the mission of patient care in hospice.
That's a perfect way to put it. It's about ensuring that every decision, every compensation structure truly serves the patient first. Rachel, thank you so much for sharing your expertise and helping us navigate these clear waters today.
My pleasure, Jake. It's always a privilege to discuss such an important area.
And to our listeners, we hope this conversation provides you with valuable insights and a clearer path forward in hospice physician compensation compliance.